Good start.
We're all back.
So you're running.
Senator Yocum, I would recognize you for Senate File 71.
Thank you, Madam Chair. Your subcommittee of Senators Yocum, Bucker, and Hatch have met a couple times to review Senate File 71. And Senator Hatch and I have signed a report recommending amendment and passage. And with that, Madam Chair, am I in order for opening comments? Thank you, Madam Chair.
Do you want to go to the amendment first?
I thought I would just give some brief opening comments, and then we'll go immediately to the amendment, and
Okay.
Senator Hatch will be handling the amendment.
Okay. You're in order for opening comments.
Thank you, Madam Chair. First of all, let me just thank so many people who are here today. I know that over the course of the last 18 months, we have had similar sizes of groups of people that have come to us to speak to us about expanding Medicaid or accepting federal funding to make sure that 150,000 Iowans have health insurance in this state. The reason we want to promote or advance this bill is pretty simple. It is morally right. It is financially smart. It costs less than the current Iowa Care program, covers more people, and provides better benefits. The bill before us does several things. It includes the coordination and integration of care in medical homes. So it is integrating into the Medicare and Medicaid system a more holistic approach of how we deliver health care to Iowans. And that is to make sure that we are focused on health outcomes rather than just the quantity. And of course, the bill also will expire or repeal the Iowa Care program, and of course, expands Medicaid up to 138% of the federal poverty level. With that, Madam Chair, there is an amendment, and Senator Hatch will be covering that.
You're in order, Senator Hatch.
Thank you, Madam Chair. The amendment you have in front of you is a combination of information that we thought was relevant to this bill, that maintains the quality and the intent of the bill that Senator Yocum discussed, and incorporates some of the concerns that the governor had initiated in his series of discussions on this. Specifically, in the amendment, it talks about the grant that the state received from CMS, the Innovation Grant, where they specifically talk about incorporating Medicaid, the existing Medicaid recipients, into a medical home or an ACO model, so that we were looking at preventive care, personal responsibility, and quality. These things are all under the ACA already. These are major pillars of the foundation of healthcare reform. So there's nothing new in the grant that we received, but it does provide us an opportunity to fold into our Medicaid system the very things that we've been talking about for 6 years. In 2008, we created the medical home and required every Medicaid recipient to be assigned to a medical home. The bill and this amendment identifies that in the first page. The first section actually changes the date from the bill to January 1st, 2015. The bill had January 1st, 2014. So we are giving the department more flexibility. It assigns children and adults and dual eligibles to medical homes, and it also provides definitions that will help us identify the kind of care we want. I would also acknowledge that on page 2, lines 6 through 38 is the actual expansion of Medicaid, so that conforms and is in compliance with the ACA. Lines 39 to 47 is a mandatory requirement of the ACA to include foster care children, so that their care goes up to age 26. But I would like to have, just give your attention to the third page, where we acknowledge that there is an innovative grant that we received from the Department of Health and Human Services. And we can't tell you exactly what the governor is proposing. We don't know. Senator Yoakum and Senator Reagan and I have a meeting with him at 3:30 this afternoon. We hope to get a better idea. But he is talking about expanding the Iowa Care program. What we want to do is to make it perfectly clear that the expansion of Medicaid that will replace Iowa Care goes to everything that my colleagues, the Republican Party and the governor have mentioned in terms of personal responsibility, preventive care, and kind of the development of cost containment. This amendment, as you look through it, identifies an oversight function of the legislature of that grant, as well as, in the end, provides an implementation plan that the idea of this of everything we've done in healthcare reform in Iowa and in the nation is to make it more affordable, not to provide a greater entitlement program. So what this bill does is integrate the medical home, the ACOs, the integrated service delivery system that everyone is talking about, where we are providing payments based on outcomes, not a fee for service, so that we don't pay for the same thing over and over again, that we give the flexibility to the providers who give direct care to people, the ability to pay for their outcome. We are talking about making people healthy, keeping them healthy, and those that are chronically sick, get them cured. So this is not just a bill that is going to expand Medicaid. This is a bill that will provide an integrated system for all providers so that payment is understood, that consumers are protected, and that really, truly, Iowa becomes the healthiest state in the nation. Thank you, Madam Chair.
Thank you. Are there any questions or comments? I did want to point out that you did, with that amendment, you put in the foster care children, and that was a bill that we had on our list.
We integrated that.
And we integrated that into this amendment. Just want to make sure that all the members realize that. Are there any questions for Senator Hatch on the amendment? Seeing none, would you like to vote short form?
Yes.
Short form. All those in favor signify by saying aye.
Aye.
Those opposed, the amendment's been adopted. We are now back on the bill. And Senator Johnson, do you have questions or comments?
Thank you, Madam Chair. On behalf of Senate Republicans, I want to thank Senators Yoakum and Hatch and Butcher for their work on Senate File 71 and the others who have spent many hours. I want to assure everyone who's here that many hours have been put into this bill. I want to acknowledge that two people have come from a far distance. I have representatives from the Rock Rapids Hospital in Lyon County. I just want to note that they are closer to Pierre in St. Paul than they are to Des Moines, but they recognize that what we do here is important to them, not what they do in Pierre and St. Paul. Each of us is reaching for the same goal here on this committee, and Iowans are reaching for that too. Healthier Iowa, an Iowa where the most vulnerable and the most challenged are not shunned, but rather provided an opportunity to receive the high-quality medical care being implemented. With this legislation, if adopted, the current Iowa Care program, like Medicaid, a state federal plan, but on a very much limited basis, will expire. The question is, can we rely on our federal partner to sustain its promise that Iowa will receive for as long as budget analysts can see hundreds of millions of dollars for Medicaid expansion, and make that tens, if not hundreds of billions of dollars for all states that opt into that expansion. To be sure, the federal government has promised to fully fund the cost for an estimated additional 150,000 Iowans for the next 3 years. In the fourth year, should this bill be adopted, we will begin to require the taxpayers of this state to start picking up part of the tab. All this from a dysfunctional federal government that budgets, if you want to call it that, by sequester. And all this for Medicaid as it is. It's a program that has low healthcare reimbursements, that is not based on outcomes, that has few quality standards, and that it has some health providers closing or else considering closing their doors to additional, I want to emphasize that, Medicaid eligible patients. Ladies and gentlemen of the committee, there is no rush to judgment on Medicaid expansion under the ACA. The U.S. Supreme Court has affirmed that there are options for states, and there is another option. Governor Branstad will be offering a plan to redesign Iowa Care, a plan that this committee has yet to study and evaluate, but we can begin that process tomorrow when the governor's plan is released in detail. During meetings of this policy committee, as well as meetings of the Health and Human Services Appropriations Subcommittee, a steady parade of presenters has advocated for Medicaid expansion. Meantime, Governor Branstad has just returned from Washington, D.C., as we all know, where he personally provided an outline behind a waiver request to redesign Iowa Care in lieu of Medicaid expansion. The governor met with the U.S. Department of Health and Human Services Secretary Kathleen Sebelius to explain his intent for revamping Iowa Care. As mentioned before, Iowa Care expires this year. That gives us the opportunity to weigh, I'm going to tag it Iowa Care Plus, against Medicaid as we know it. Can we redesign Iowa Care to better serve Iowans and improve their health? I say yes. Republicans on the committee say yes. If partnerships, flexibility, healthy outcomes, cost-conscious behaviors, prevention, and personal responsibility are cornerstones of the plan, I'm happy to hear that there is consideration of those factors in the bill before us. It's no secret that Medicaid costs and the number of enrollees have exploded since fiscal year 2003. Has our overall health improved? Trends suggest not. Milliman Incorporated is an actuary retained by the State Department of Human Services to quantify the fiscal impact of the ACA on Medicaid expansion and our state budget. According to its study, total costs of the state of Iowa and its taxpayers for fiscal years 2013 to 2020 would be in the range of $171 million to nearly $537 million. Why such a range? The total cost would depend, of course, on actual participation by eligible Iowans as well as other assumptions. For example, the trend in health care costs and future FMAP levels. No one is suggesting that redesigning Iowa Care is based solely on financial savings, but we should always take aim at cost containment. We can do that in part through encouraging healthy behaviors. Are all the details known regarding an Iowa Care overhaul? Not yet, but again, those details will be laid out by the governor tomorrow. We are committed to working with the governor and House leadership to find thoughtful solutions to the health care. Iowa Care redesign deserves a full hearing before rushing into Medicaid expansion. I also want to add that according to a conversation that I had with some doctors in Northwest Iowa, from rural Northwest Iowa, that, and this is in light of something that I saw, a letter that we all received from Iowa's Olmsted Consumer Task Force, and the letter stated that, quote, physicians will directly benefit, end quote, from Medicaid expansion. That's interesting because recently I had the opportunity to speak with 4 doctors practicing 3 different disciplines from Northwest Iowa, and each one of them said, do not do it, in reference to Medicaid expansion. And each doctor said the current system of healthcare entitlements is so fragile that the deck of cards could fall with Medicaid expansion. That's their concern. These are doctors whose patient base is from 40 to 50% Medicaid and Medicare eligible Iowans. Senators, would you yield?
Yes, I would.
Senators, have you had any conversations with physicians about whether or not we should go down the road of Medicaid expansion?
Yes, I have. I've also spoken to a number of hospital administrators also. I do have a number that are speaking in favor of the expansion. I also have some that have contacted me personally, phone conversations that say privately they are not in favor of this expansion. But just this morning, I did have the opportunity to visit with the family physicians group. They were downstairs, and visited with a couple of the physicians that were there. Now, their group is in favor of the Medicaid expansion. However, when I asked them personally, tell me what you think about Medicaid expansion, they said they were not in favor of it. One was a physician that had practiced in Cedar Rapids. He's no longer practicing in Cedar Rapids, but what he said is that in eastern Iowa, and again, I'm taking this on what he told me this morning, in eastern Iowa, there are a number of patients that are moving in from Illinois because they cannot be covered by Medicaid in Illinois. So they're coming to Iowa to be covered. And I went back and I did a little research because I didn't on his word, but I did find a recent article from the Daily Chronicle in Illinois that said that more than 35% of Illinois doctors have stopped taking new Medicaid patients, and Medicaid patients are denied appointments with specialists nearly 2/3 of the time. So I know Medicaid expansion is a hot topic right now. It is a very hot topic. It's a hard decision to make. But why would we make that decision without looking at all of the options that are? We see this in other states, what's going on. I'm afraid that this will happen in Iowa also. So I thank you, Senator Johnson. I thank the members of the subcommittee that have worked diligently on this. And I appreciate you asking me. Thank you, Senator.
Thank you, Senators. Thank you, Madam Chair.
Thank you. Senator Hatch?
Thank you, Madam Chair. This is a good discussion. Actually, I wish we had it 6-8 weeks ago, because this is the kind of discussion we have when we start making good decisions. The problem, Senator Ernst, on your discussion today is that all those doctors, a few that you talked to, and that newspaper article, were talking about the old Medicaid. That is what the Accountable Care Act replaced. We knew it wasn't working, it wasn't sustainable. Those arguments are arguments that should have been and probably were presented to the congressmen and senators of the U.S. Congress. It is established that the integrated model of accountable care organizations toward a new payment system, toward outcomes, is the future of healthcare. To use the arguments that the old Medicaid system is going to be the new Medicaid system is just outright wrong. And I can see why doctors are skeptical, because they weren't paid well, because it was difficult, and it was cumbersome, not only for the doctors and the providers, but for the patients. And remember, we were talking about people in the old Medicaid system where there was disabled children or parents with children. And we're talking about the very, very poor. So those are difficult people to provide health care to. And to bring to this committee the acknowledgement that we have a few doctors and a few hospitals that don't particularly like it, I think is discourteous to the organizations, the Iowa Hospital Association, the Iowa Medical Society, the family physicians, that in a broad way are willing to take a chance with us. Take a chance that there's a new way of doing it, and it's not an untested model. I mean, we passed this legislature medical homes 5 to 6 years ago because we know what coordination of care means. So when we have an integrated service delivery system, we have a patient spending time not only with a doctor, but all the other services necessary to identify what their health is, to diagnose it, to treat it, and to maintain health of that individual. We have a community relationship and a social services agencies that will be involved in the coordination of care. And not only do we do that, we do it with the other disciplines. Unlike Iowa Care, that is paid for insufficiently with Iowa funds, general funds, they don't take in consideration behavioral health, prescriptions, transportation, or where they can actually get service. And to acknowledge that that is where we should be reaching to after a new system has been established where the medical providers understand that let's not go backward, that we have to go forward, is kind of discouraging. I think we have probably an argument here that's being presented, kind of a strong man argument. The federal government isn't going to provide the services in the future. Now, I know that my colleagues feel that the federal government and state government is not dependable. And what we see in what's going on in Washington, believe me, is not embraced by any of us here. But to deny people the right to get medical care because you're afraid the federal government may not fulfill an obligation is acting like the people in Washington. We're better than that. We need to understand that we want to take care of Iowans. And if it means that we have to jump out a little bit ahead of everybody else, let's do that. Let's not worry about 4 doctors up in my part of the state. Let's listen to the people who are doing this every day, all day long, every year, for dozens of years in our communities. The hospitals, the doctors, the nurses, the There are over 50 agencies and organizations that support this legislation. And yet, there has been very little discussion with any of them. Talk to the patient who couldn't get aid or couldn't get treated at the local hospital in Creston or Clarendon and had to come to Iowa or Bronx weeks after they needed care. And don't say we're going to wait for the governor's plan. I was in Washington yesterday. I talked to the very person who was in that room, and the governor did not have a plan. And Secretary Sebelius said, we will entertain one if you write and give us one, but he hasn't. And we're 6 weeks into the session. And as all of you know, we need to pass legislation to expand either Iowa Care or Medicaid, or Iowa Care and expires by the end of this year. And that means 70,000 Iowans will go without care. I don't think anybody wants that. We need to work very hard. And our message to the governor today will be, let's put a work group together. If you're interested in really having this discussion, let's get members of the House and the Senate and the governor's office together and not talk about ideology anymore. Not talk about things you don't know about anymore. Let's sit down and really get our heads around this and go back to our community, say that we are going to be listening to you and not to some ideology coming out of Washington. Thank you.
Senator Bolt.
Thank you, Madam Chair. Thank you, Senator Yoakum and Senator Hatch and others that have worked on this bill. I can't really think of a more important piece of legislation that will strengthen and benefit the people of our state than the bill before us. In the 15 years I've been here, we've done a few really important things around the health care of our people, including raising the tobacco tax and making smoke-free workplaces. But it seems to me that providing basic health care to more than 150,000 Iowans, it doesn't get much better than that. Iowa Care, and I'm happy to entertain the notion around Iowa Care in terms of improving it, but Iowa Care is really for people that are in poverty in Iowa and people that are in health care crisis. It is a crisis program, and it's actually quite costly. I think it's time to set aside this ideological fight we're having about whether people ought to can get access to Medicaid or not. We have 8 Republican governors that have agreed to move forward. It's the right thing to do. We have more than almost $1 billion of uncompensated charity care by our hospitals and bad debt. We are paying federal taxes that are going to expand Medicaid in other states. In our health care costs through the premiums, those lucky among us that have health insurance are higher to pay for all that charity and uncompensated care. We can save money. We can improve our rural hospitals. We can improve health care for very many people. we've kind of had this conversation today about, Senator Johnson, the notion that Medicaid costs have increased over time and somehow people haven't gotten healthier. About 70% of the existing Medicaid program are people in nursing homes and people with disabilities. Generally, when somebody goes to a nursing home, we don't really think they're probably coming out and going to get better. People with disabilities generally have those disabilities for a long time in a long-term care setting. So that's kind of the supports that we've all agreed are important. And then we provide care to lots and lots of kids. And kids, as we all know, don't cost a lot, but there's a lot of uninsured kids. So, the growth in the system has been the result of economic downturn, increasing poverty in our state, and increasing aging. So when we talk about historically where the costs have been, it's been for seniors and people with disabilities principally. We have an employer-based healthcare system in this country. We have thousands and thousands of people that go to work every day that work for people that can't afford to provide insurance to them. Those are the folks we're talking about here, because 80% of Iowa's uninsured folks that are going to get benefit here are people that get up and do the right thing every day. They go to work, they try to support their families, and we don't have a place. They don't have a place to get health care. And so that's what this bill's about. And the other notion that's out there, which I think is a little odd, is the personal responsibility argument. Of course people should take care of themselves. Of course people should eat right and exercise, right? But we know that people are going to get sick. At the end of the day, you do all the right things, and I think even the governor has gotten medical attention, and he seems like he takes care of himself. So personal responsibility is not going to let you avoid a trip to the doctor, avoid some genetic predisposition you might have for cancer or some other condition. We have an epidemic of breast cancer in this country. Do we all think we can solve that through personal responsibility? We increase in things like autism. Is that going to be solved by personal responsibility? I think not. I think we have to have preventive services and healthcare services for people, and of course we want people to take care of themselves. But personal responsibility is not a healthcare program. It's not a health insurance program. That's what Medicare is, or Medicaid is. It's a health insurance program that provides resources to medical professionals. The other notion was, people, we're spending all this money on Medicaid and people aren't healthier. Well, it's an insurance program. Money is going to providers. I think the providers do a pretty good job with the money we give them under this program. It's not somehow the providers are giving second-rate care. I talk to providers, they provide Medicaid services, reimbursement, well-marked reimbursement, other reimbursement, and they give all the same care to the patient, no matter who the payer is. So the idea that somehow Medicaid is resulting in providers giving inferior care just isn't true. Senator Yoakum, I think you summed it up. It's a smart thing to do, and I'm pleased to be able to support this bill out of committee today.
Thank you. Senator Johnson.
Thank you, Madam Chair. We are not denying medical care here in what we're saying. I hope that that's not being suggested. There's a lot of things I can address that's part of the discussion. Just based on the American Medical Association, 25% of doctors represent or are represented by that association. So that doesn't mean that the doctors I talk to or any other healthcare professional who belongs to an association is represented by the association, with all due respect. Nursing facilities, they have improved, that's beyond me. They have improved shortening the stays of the residents. It isn't the end of the world for people who are going to nursing facilities. Okay, so we'll take the point that we're talking about, not the old Medicaid, but the new Medicaid, all right? Then let's take the point that we're talking about, not talking about the old Iowa care. We're giving the governor a chance tomorrow to explain the details of a new Iowa care program, and we ought to give that a fair hearing before proceeding down the road. Just want to reemphasize that position. We ought to be talking about it. Timing isn't absolutely the most perfect for our fund days, I realize that. This bill will probably advance out of this committee today. That's accepted. But we are keeping the discussion open. Thank you, Madam Chair.
Thank you, Senator Johnson. Senator Cornbach.
Well, thank you, Madam Chair. I was here when Iowa Care program was created. It was created under some adverse circumstances where a new federal regulation or a new interpretation of a federal regulation was going to deny Iowa a lot of federal money that we had come to depend upon. And it was only by some creative work on the part of the governor's office and some other folks to create the Iowa Care program, to create a set of limited circumstances and limited services that would allow us to retain the federal funding and to provide service to a certain segment of the population. Under those adverse circumstances, it was a very well-chosen program. But by no means was anyone, either then or now, under the impression that it was in any sense ideal. It covered a very limited number of people for a very limited type of service. And oh, by the way, it was 4 times as expensive as the proposed Medicaid expansion. Our share is 40% and not 10%, which the long-term share would be for the state under the Medicaid expansion. So Iowa Care, you know, it was a good response to a difficult situation, but by no means does it provide us any kind of rational basis for an expansion. I don't see any real reason to continue down that path when we have a clearly superior path available to us. Now, as far as the objection about the reliability of federal Medicaid funding, I can tell you the reaction of one of my county supervisors, or former county supervisors, someone who served for several decades and was a leader at the local and at the state level as far as mental health and mental health services and reform was concerned. Her reaction was that the federal funding for Medicaid, that reimbursement, was a heck of a lot more reliable than was the state funding for mental health. So if somebody wants to throw brickbats at the federal government, well, you know, you ought to have your own house cleaned up first. Now, the large question here is how to minimize the cost, not just to the state or the federal government, but how to minimize the cost to society of providing medical care. People who don't have medical insurance, they still get sick, and they still get medical care. The problem is if they don't have insurance, most often they get that medical care by showing up at the emergency room when their conditions have gone to dire, to life-threatening. And God bless the people who work in our emergency rooms, but that is the least effective and most expensive form of care because the conditions have gotten out of hand and extreme measures are often necessary. So how do we cover people in a way to make sure that they get regular care, to deal in particular chronic problems before the costs and the severity of the condition get out of hand? We had a presentation actually in this room a week or two ago from one of our Medicaid officials who gave us an excellent little tutorial and reminder of how the Medicaid system works, and also some of the things that they're working on in the way of cost control. One of the startling facts that was presented was that only 5% of the population drive about 48% of the medical costs because they have chronic conditions like obesity and heart disease and hypertension and diabetes. And under our Medicaid system, we are making reforms like medical home to provide coordination of care to make sure that these long-term problems are well managed so that the patients get better outcomes and the state's cost is controlled. Well, the question I raised at that point was, what do we do about all the people who don't have Medicaid coverage or other medical insurance coverage? How can we enroll them in medical home and other cost containment options? And her response basically was, we can't, because they're not in the system. So it's not just that we're already paying the federal taxes, as I think Senator Bolcom pointed out, for this program, for the Medicaid program. It's not just that we're paying a second time when people show up at the emergency room and their costs have to be covered by all the rest of us, the cost shifting to those who have insurance. But it's the costs overall that we're paying for, not once but twice, but those costs are far higher than they ought to be and that they should be and that they could be if we were to expand the Medicaid program and bring more people in under its umbrella so that we could manage their conditions better and have far more effective cost controls. I think we need to move this forward out of this committee today. Moving it out of committee today doesn't make it law. It helps to continue the conversation. If the governor would like to join in that conversation in a more constructive fashion, that is of course welcomed by everyone, but we need to move forward. We really need to move forward.
Seeing no more.
Thank you, Madam Chair. Senator Cornbach, I'm a little surprised that you would say that the federal government has their house in order. They have $1 trillion deficit every year. They have for several years. They have.
I don't believe I said that, sir.
I think the quote was the federal government has their house in a lot better order than the state government when you're talking about.
No, I said with regard to funding. What I said was with regard to the funding of Medicaid, they are much more reliable. I'm correcting the gentleman's statement. If you'd like to ask me to yield, I'd be happy to engage, but please don't misquote me.
I didn't ask, Senator you. And on the other hand, the state does have an ongoing surplus, which is a lot better than $1 trillion deficit. Also, it's my understanding that several states that have went ahead with this expansion those states that are worried about the federal government not meeting their obligations have put in clauses to address that. And if we're confident that the federal government will meet that 90% obligation, I think the committee should consider some sort of clause, some sort of sunset clause that if they're not upholding their end of the bargain, then the expansion sunsets. And I would encourage the committee to work on that as it goes towards the floor if we're confident that's going to happen. Thank you, Madam Chair.
Senator Cornbach, did you have any comments?
My statement was simply that, and I was quoting one of my county supervisors, our statement was that as far as Medicaid funding is concerned, the federal government was a more reliable partner than was the state as far as funding mental health. That was the only comparison I was making. And actually, I wasn't making it, I was simply citing another person's experienced point of view.
Senator Bolcom.
Thanks. Thank you, Madam Chair. Sorry for the second time. So, would you yield? I appreciate your concern and the question about, what is it, 2020, 2019, where, we go from we phase to a 90-10 state match, and the notion that we put language in a bill that would address that if we got to 2019 or 2020 and the money defense said we can't afford this anymore and you're going to have to pony up more state. If we were to go down that path and think about that, would that get you to a comfort level where you'd be willing to support this effort? Or you just
we'll see. We'll see. Let's draw up an amendment and look at it.
Thank you.
There's obviously a lot of concerns with this bill. It's a huge issue that affects thousands and hundreds of thousands of people. That's one issue that we have. Let's work through it.
Okay, thank you very much. Thank you, Madam Chair.
Seeing no more discussion, I would ask Senator Yoakum to have closing comments.
Thank you, Madam Chair. I know that this is an issue that is very important to everybody in this room, regardless of our party. And this is not today about a Democrat or a Republican. It's about 150,000 Iowans, all of whom live in our districts. And whether or not we are going to pass a bill out of committee today that's going to give them health insurance. That's simple. That's what it's about. The handout that we gave everyone on comparison, I just wanted to refer back to that just for a second. I know we're running late on the committee, but I have looked at the governor's sheet, an outline of what he wanted to do, and those things that we know are on this, things that are unknown, he says unknown. Currently, Iowa Care today covers our citizens up to 200% of federal poverty. The governor's sheet does it up to 100%. Medicaid expansion up to 138%. Currently, there are about 65,000 Iowans in Iowa Care. The governor plans to cap that at about 75,000 versus the expansion of 150,000 Iowans. Today, it costs the general fund $24 million in Iowa Care, and the governor does have a 20 fiscal year for Iowa Care versus $2 million if we expand Medicaid. Currently, under Iowa Care and under the governor's proposal, Polk County taxpayers pony up $42 million in property taxes to cover Iowa Care. Same under the governor's plan. Our plan saves Polk County $42 million. University of Iowa Hospitals currently is spending $32 million on Iowa Care, and under the governor's plan will continue to do so. Under Medicaid expansion, University of Iowa Hospitals saves $32 million. Under Iowa Care, under the governor's proposal, to the best of our knowledge, mental health services are not covered. Are not covered. Costs our taxpayers in every one of our districts on our property taxes about $58 million. If we expand Medicaid, that $58 million is included in the expansion and saves us money, and finally puts very much needed money into a mental health system that has been incredibly underfunded for many, many years. And I could go on in terms of who the providers are under all these different scenarios. I am more than willing to look at what the governor wants to propose. And he has had quite a long time to submit something to us. So I will certainly give his proposal a solid look. No problem with that. And I suspect if I ask family physicians if they would like to have Iowa Care, if they like Iowa Care, I suspect those same family physicians and same So, where are we at? Senator Johnson, you raised some great questions. I believe that you are very committed to making sure Iowans get health insurance. You mentioned the $500 million amount of money that looks like it's going to cost us. But let's just clarify that. Under the minimum report, that $500 million was called the Woodward effect. In other words, people right now in this state who are eligible for Medicaid at 100% of federal poverty and don't realize they're eligible and believe that now that this issue has become far more aware in people's minds that they will begin to sign up. Whether we expand Medicaid or not, those amounts of money will be there. Doesn't matter. But we do know from the projections from Fiscal Bureau and others is that if we expand Medicaid, it's going to save this state about somewhere between $117 and $206 million over the first 7 years of Medicaid. Is that if we expand Medicaid, it's going to save this state about somewhere between $117 and $206 million over the first 7 years of Medicaid expansion. We save money. We save Polk County taxpayers money. We save the University of Iowa Hospitals money. We get more money in our mental health system. There's no comparison. There's just no comparison. It was mentioned on FMAP levels. That has nothing to do with Medicaid. That is a formula that is based on a state's employment numbers. Our state has fared better in this recession than most other states. So of course the levels are going to change. That has nothing to do with Medicaid expansion, nor does that mean the federal government has reneged in any manner, shape, or form on its Medicaid commitment. This state, this country has had Medicaid for 40 years now. 40. And yet the federal government, I will agree, has reneged on different promises it has made to the states, as the state has reneged on some of its promises. But one thing I can tell you with absolute assurance is that when it comes to Medicaid, they have never reneged. And Medicare is off the table on sequestration, off the table. Will not be touched. There is an opt-out option. Some states have done it, as you have suggested. We certainly could entertain that. So if for some reason the federal government reneges on that 10% that they want us to pay in year 2020, a legislature can opt out. But when we opt out, we do need to have a replacement for it. So this is where we're sitting, folks. If we do not expand, we're going to let $3 to $4.5 billion sit on the table. The Affordable Care Act, when it was passed in 2010, was adopted or enacted under pay-as-you-go rules. It's paid for. It's already paid for. I can't help it if the U.S. House of Representatives repealed the pay-as-you-go rule in 2011. But when this was enacted, it was under pay-as-you-go rule. It is paid for. In summary, it's morally right. It's financially smart. It reduces by half the number of uninsured Iowans. It increases preventive care and avoids costly health problems. It will shrink Iowa's annual $1 billion bill of uncompensated medical care that costs every Iowan who's fortunate enough to have health care. It's going to save us money. Because we do pay for that uncompensated care now. Don't fool yourselves. We are paying for it. It is just the morally right, responsible thing to do. With that, Madam Chair, I call for a record roll call and ask that this bill be placed on its final passage in this committee and go to the floor of the Senate.
Senator Reagan. Aye. Senator Wilhelm. Aye. Senator Johnson.
No.
Senator Butker.
No.
Senator Volcom.
Aye.
Senator Godsler.
Aye.
Senator Ernst.
No.
Senator Hatch.
Aye.
President Yocum.
Aye.
Senator Mathis. Aye. Senator Kornbach.
Aye.
Senator Segbart.
No.
Senator Whitmer.
No.
That's 8 aye, 5 nay.
The bill has received majority and will move to calendar as a committee bill, as amended. Thank you all. I do not think we have time to do anything else here today. We have other bills listed, I know, shucks. But thank you for looking at it. Well, somebody else.
Public schools are the foundation for